Dr. Doug Lucas here, retired orthopedic surgeon, now focusing my career on health span and bone health. If you have osteoporosis or osteopenia and you've been looking for a natural solution for your bone health, you may have run across the question of hormone replacement therapy. Now, there are few areas in medicine that are more controversial than HRT. I'm going to talk very specifically about one part of HRT that is not always recommended for women with testosterone. I want to talk about the research on testosterone and the impact on bone health. So if you're interested in testosterone and you're interested in improving bone health, stick around because I'm going to go through some of the research that talks about the specific role that testosterone can play on bone health. So if you're new to the field of hormone replacement therapy and you're considering it for yourself, you may or may not have been told about testosterone. I'm going to talk about why most doctors don't talk about testosterone for women, but first I want to talk about why testosterone may have an impact on bone. We know, based off of most people's experience, that if you have higher testosterone, you're going to have likely more muscle mass, assuming you're using your muscles. We know that testosterone directly impacts lean muscle mass. It directly impacts body composition. Usually when people are on testosterone, it'll reduce body fat, depending on other factors, of course. But what isn't often talked about is the direct impact that testosterone has on bone health. And I'm going to go through that research. Testosterone not only directly impacts your bones, it actually will also convert in both men and women into a form of estrogen. That estrogen will also have an impact on bones, which we'll cover comprehensively in another video. But testosterone then will hit both the anabolic side, the P1NP or osteoblast side, but also the osteoclast side indirectly, which we measure through CTX. So it affects the bone metabolism balance on both sides in a positive way if bone growth and bone development is what you're looking for. So if that's true, why isn't it talked about more often? I get this question all the time. And here's the thing. When drugs are not FDA approved for a purpose, and I'm going to be very clear here to say that testosterone is not FDA approved for osteoporosis. I'm not saying that it is. All I'm talking about is the research behind testosterone and bone health. But when a drug is not approved for something, doctors have to go out of their way to prescribe it off-label for something. And the challenge with testosterone is that not only is it not approved for improving bone health or anything around osteoporosis, but testosterone really is only approved in women for specifically sexual dysfunction, concerns around libido, and there are not very many commercial products available. In fact, there weren't any available for a long time, and I think that's changed now. The practice that most physicians in the health optimization space use, though, is to use, again, off-label, compounding things that are not made by drugs. So typically they're using compounding pharmacies to create a testosterone cream or an injection for men, and that's how we're providing testosterone. So if you go to a doctor in the traditional medical system, so you go to your OBGYN and they're prescribing you estrogen and progesterone as hormone replacement, they're unlikely to talk to you about testosterone because they're simply just not trained in it, and there's not a commercial product for it, and they would have to prescribe it off-label if they wanted to. So it becomes challenging, and it's a difficult web to weave through as a provider, but there are so many reasons to use drugs off-label that this is something that we can ask a comprehensive set of questions, and we can find a good reason to use all types of different tools for different things. So I think as a consumer, it pays for you to understand the benefits of certain, especially hormones, but any type of thing, supplements, peptides, et cetera, that could potentially impact something that you're interested in. So I'm going to go through the research on testosterone and how it specifically impacts bone health for your own knowledge. All right, so let's talk about some research. Now, this first study is actually done on men, and I'll talk about why here in a little bit. But this is a study from 2001, and what this study used is a commercial product that's only FDA approved for men, but it's a testosterone patch. This was a placebo-controlled study, and both groups in the study also got calcium and vitamin D, because that's the standard of care. Now, I like the study because they looked at both bone mineral density, specifically at the femoral neck, which speaks to me as a surgeon, and they also looked at bone turnover markers. So we could really see, is there an impact in bone mineral density and what's happening to the metabolism of the bone. So the interesting thing about this study is that there was actually a pretty high withdrawal rate. So 34% of the patients did not make it to the end. Now we know when we do statistics, you have to include everybody. So this is called intent to treat analysis. And so when you include everybody, it could potentially change the way that the numbers read out. The statistics here at the end do show benefit. Now, I'm going to talk about some caveats here, but just in general, bone mineral density did go up, although just slightly, in the femoral neck. This was over the course of 12 months, though. And in the control group, it went down by 1.6%. So it's better, right? So bone mineral density went up. The significance there, too, though, is interesting, is that even though the control group was on calcium and vitamin D, they lost that much bone. So it just goes to show that you really have to do more than the standard of care, which is calcium and vitamin D. The testosterone group also saw an increase in lean muscle mass, and they saw a decrease in body fat. So again, body composition improves, again, as you would typically see for people on testosterone. The bone turnover markers didn't really change very much. And I think I can guess why. All we can say from the study is to say that this dose of testosterone did not have a significant impact on the bone turnover markers. When you look at the amount of increase in testosterone on the labs, they did show that there was a statistical increase in testosterone. One of the challenges that I have with the commercial products for men in particular is that for men, we really want to drive testosterone almost to an optimal level where men felt their best. This is the difference between health optimization and traditional medicine. Men feel their best with testosterone levels around when they were in their 30s, maybe 40s, maybe 20s, kind of depends on the person. The commercial products for testosterone for men don't get you there. In fact, if you look at this study, the level of testosterone went up just marginally. So I think that's why we're not really seeing a change in bone turnover markers, because I don't think it really probably had that significant of an impact. And I also find that when you barely give people testosterone, a lot of times you're not going to find that they're going to be compliant because they don't feel any better. And this group, they didn't really talk about that much, but my guess is that they probably didn't feel that much better, and that's why you saw so many people discontinue over the course of the study. So what does this study show me? It shows me that BMD did respond to even a tiny dose of testosterone, which is promising, but this in itself doesn't conclude we should consider this as a tool. So let's keep looking. Hey, sorry to interrupt this talk on testosterone, but if you like this content, please like, subscribe, and sign up for notifications. If you know anybody that would benefit from this material, please share this with them so they can continue to learn on their own bone health journey. If you want to learn more about how we manage osteoporosis or other tips and tricks you could consider for yourself, look for our free masterclass link in the description below. All right, so I really wanted to find a study on testosterone in women. And I was looking for a study that would have a demonstration of bone mineral density over time, reduction in fracture risk, change in bone, metabolic markers, and I couldn't find any of those things. At the beginning of this video, I talked about how there are no FDA-approved products for testosterone, specifically for bone health for sure, and that there are really few commercial products in general. When that happens, we see this gap in the knowledge base because nobody's doing the study on this group to show that there would potentially be a benefit because there's no money to be made. And so we're kind of stuck treating our women based off of knowledge that we know about men. Now, this has been an issue in medical science for decades, and this is something that we are changing slowly over time, but unfortunately in this arena, this is something that we just have to deal with. So I do have another study, and this one unfortunately is on men, but it's a much bigger study. Okay, so this is a 2006 study, and this is actually a meta-analysis of other randomized control trials. So this is bringing together all of the available data at the time of this study. And testosterone has been studied quite a bit in men. And it's studied in men because we know that low testosterone is a risk factor for osteoporosis and falls in men. And so the purpose of the study was to say, okay, what is the change in bone mineral density with testosterone replacement? What are the potential risks? And that's really what they were going for in this study. So I always want to find the decrease in fracture risk. That is ultimately what we care about when we're dealing with bones, and that's what I'm looking for in the research studies. Unfortunately, none of these randomized controlled trials looked at fracture risk, which I think is unfortunate. But ultimately, fracture risk is hard to assess in a small trial. You really need really big numbers. And so that explains why that didn't happen here. But they did show bone mineral density improvements. And what they showed was about an 8% on average increase in the vertebrae and about a 4% increase in the femoral neck. Now, statistically, technically, the vertebral changes were significant, the femoral neck changes were not, even at 4%. But the reason why is because there was quite a bit of variation in this study. So some studies showed no change in bone mineral density. Other studies showed more change in bone mineral density. In fact, I think the highest in the spine was around 13%, which rivals any of the commercial drugs available for osteoporosis. So what is my take on this research? This research shows that in men, testosterone does increase bone mineral density. And so it would be reasonable to use this in conjunction with other symptoms for a comprehensive approach to health. I think that's very reasonable. To then take that into using it for women, using it for other purposes, it really requires a discussion of risks and benefits with somebody who really knows the space well. So that could be somebody on your own team. If you don't have that person on your team, then consider signing up for our free masterclass where we talk about, our approach to osteoporosis in general, tips and tricks you can do on your own, and then ultimately consider our programs where we're coaching people through these things in different manners and different levels. So that's it. You made it to the end of this video. If you enjoyed this, please like and subscribe. We know that we're seeing about 10,000 views a month and we only have about 5,000 subscribers. So please subscribe. The more people that subscribe, the more likely we are to show up on other people's searches on bone health. So please subscribe, like, and share this with people who you think might find benefit from it. Lastly, we love comments, we love questions. So if you have questions, if you have comments, please leave them below. We answer them daily, and we love ideas too about what people want to hear. This was an idea that somebody wanted me to talk about, and so that's why we created this video. So please let us know what you want to hear. I look forward to hearing from you and seeing you in our masterclass. Thanks again.